Hi, everybody. We want to welcome you to Coronavirus Inside the Arizona Numbers, where we take a much closer look for you in an extended amount of time at the Arizona-specific numbers so that you can have the best information to make choices for your health and your family. You know their health and lifestyle best. We're just here to help guide you through the numbers. And really, now that we only do this week to week, is to teach you where to find these numbers so that you are empowered to find the numbers for yourself throughout the week when we're not here with you. We have a lot to talk about today, a very busy time as we're seeing this increase in number of cases, both here in Arizona and across the country. I was telling some people on my Facebook page earlier that we're having a diagnosis in the US of COVID every 1.2 seconds right now. We're having a death from COVID every 107 seconds. So it's something to consider as we head into the holidays and making adjustments for your life as well, and what fits best for you. So Garrett, let's get right into the numbers here in Arizona. We are seeing what they're seeing across the country with this increase in cases.
We are indeed. I have the cases by day selected here, but I put it into a weekly format. This is on the AZDHS website. And you can see sort of how we have right here, when we look at May 31st, this is sort of when we began our trajectory. We were at about 79.25 cases a week, and now we're at about 78.07 from the week of October 18th. That does, as you can see, it mirrors the growth from week to week from back in May. We do not know if that means that this next week is also going to have this 40 to 50% increase that we saw on June 7th from this 4,000. I mean, this is exponential from 7,000 to 12,000, really exponential right there. We don't know if that's going to happen. We don't know if that 7,800 is going to move to 1,200 or 12,000 in this next week. But we are all the ingredients are there for something like that to happen. So we do have to be diligent and watch this. We can see this isn't happening everywhere. We can see like Palo County, it did go down. We do have some interesting numbers in Pima County. They did have a bad week last week. We had some really high numbers in central eastern Arizona. We saw a lot of big numbers here. As you can see, Gila and Graham counties, even Greenlee County from the last week, 28 cases. I know it doesn't sound like that, but there's only about 10,000 people in Greenlee County. So anything that is any sort of number in Greenlee County does significantly increase the per capita numbers. When you look elsewhere, you look in the north, you can see increases as well. Here's another one. You can see Navajo County sort of reflects what's happening in the state. Coconino County right now is going through sort of what they were at the peak, and then Mojave County a little less. So you can kind of see just based on this where things are hitting the hardest and where things are sort of they haven't really hit quite yet. So that's sort of where we are. We are in increases right now, about a 30% increase across the board, and we'll see how long that continues.
So we have so much information to get to that we won't have as much time for all the questions, but I do see one question I want to help answer, and that's from Debbie. She says, I've heard the numbers of positive cases have gone way up, but all I've seen shown, I think is what she intends to say, is that deaths continue to be very low, so I'm confused. So this is a question we get a lot, which is why I want to address it and help Debbie get the answer she's looking for. So deaths in these charts always lag, because remember, you don't necessarily get a diagnosis and then walk out of the office and pass away. So deaths lag. So first of all, we're going to see diagnosis, and then we're going to see an increase in hospitalizations, and then sadly, we'll see an increase in deaths. So those numbers, as much as I wish they were not coming, they are a lagging indicator. So we'll see those show up a little bit later, unfortunately. And the thing I always say, people are getting diagnosed now, and then we're going to be reporting on this stuff around Thanksgiving and over Christmas. And that's why it's so important to take necessary mitigation steps and precautions now.
We do have to also put into consideration that when you look at the death chart, which I do have up, this is a much more, it's much more recent than it used to be. Although we'll have times like today, for example, 5 of the 16 reported deaths today came from August or prior. And you can see there obviously is a lag. But at this point, we could also be, and this is just speculation, but there is a consideration that maybe the virus has mutated a little bit and is less deadly, and also that we are doing better at treatments at hospitals. And so our death numbers may, even though they will very likely go up, because we're seeing increases in cases, we do not know if they're going to go up at the same rates they did in May or June. They may not go up as high. I've seen modeling that does suggest that they're not going to get to where they were back in June and July as far as the daily numbers. So that's just something to take into consideration as well when we talk about deaths. They are low now. They will likely go up, but we do not know if they're going to go up at the same rates that we saw in June and July.
Yeah, we certainly hope that everybody's getting better on treating this and learning about what works and what doesn't work. Oh, Debbie writes, oh, thank you. I appreciate the answer. Debbie, you're so welcome. We talk about the increase in cases. We've also seen an increase in testing. Some people have been sending us pictures once again. This is like deja vu all over again, but we're getting pictures sent into the newsroom of some longer lines out there at the testing sites. You're seeing that reflected in the numbers. More people are getting tested. I think also, Garrett, more people are understanding how easy it can be to get tested. If you've done the saliva test like I did through ASU, it's a drive-up test. You spit into a canister, send it in. And for me, remember, it was back in July. It took a few days to get it back, and we thought, boy, that was quick because everybody else was waiting a couple weeks. And now most of those test results are coming back that evening. You can test in the morning and likely get an answer by about 10 o'clock at night. So pretty incredible, the pace at which that's happening. How do those numbers then reflect in the number of tests that you're seeing, that you're also tracking?
We are seeing a significant rise in testing, and I'm going to stay with the ACDHS site for now, just because that's the easiest one for people to get to. And we are seeing a rise. We are seeing, in fact, our numbers right now for last week. Hold on, I think, am I on one test day special? Okay, for some reason it says Graham there. I don't know why. That's very strange. Let me see if I can move this a second and get that. All right, there seems to be a slight error on ACDHS where they're saying the word gram right here in date of specimen collection for the week. However, we are seeing the number of tests should be correct, and that's 87,129. We were around there at July 30th, so we are at the point where we're getting to where we were testing at the very peak of the pandemic. Now, the good things about, if I have to say that there's a sort of a silver lining in some of these numbers, is that if you remember and you recall back then, there were people waiting in line and they didn't get the results for 5, 6, sometimes 5 weeks, 4 weeks. I mean, the lag was back then. It was very long, and now we don't have a lag. We haven't had a lag for probably the entirety of the last 2 months. And so when we see this testing, when we see these cases being added, we are more confident in those numbers, like the RT number, and what's going on outside and what the numbers actually look like, because we're not chasing this thing to the rate that we were chasing it back in June and July.
Yeah. Some of the other questions coming in, Margaret's asking if people are going to be doing trick-or-treating. Does that seem safe to all of you? Does it not? How are people feeling on that? I'd love to hear in the comments. She writes, who's doing the door-to-door trick-or-treating? I'm not allowing that, but my child's dad thinks it's safe. Just curious. Thanks. Would love to hear what you all are doing. My neighborhood's doing something great. Everybody's already put the candy together and set it all up and mapped out the houses. So they're going around to just pick it up, so it doesn't have to be handed out, and it's been in there for a few days and safe. So a lot of people are getting creative about how they're going about things. And Suzanne also had a question just a moment ago. Let me see if I can scroll back. Suzanne, why do we never have any recovery numbers? So Garrett, I think you can help Suzanne with that. And I think you're able to generate some recovery numbers, or you can show us at least the active cases. Suzanne, there's not a place here that does that for the whole state. So we're lucky enough here at ABC 15 to have Garrett to sort of do the math, plug all the numbers in, and there's a lot more work that goes into it, Garrett. But basically, you take those cases here in Arizona of 244,000, subtract, sadly, the deaths, the people who we have lost, and then generate a number based on the age of the case count. So how old the diagnosis is, that we could sort of expect that they might be feeling better. Now, obviously, Suzanne, that doesn't account for long haulers. Those are the people who are sick a very long time and have trouble recovering from this. But Garrett, the active cases, the cases that could transmit to others, I know it's increasing, but what is it looking like?
Yeah, and really that's the point there. So that recovery is a difficult thing to define. As you said, there are people that are still not recovered from this, and had this disease back in June. And so what we're looking at, instead of saying recovery, we look at, like you said, the active case count. So these are cases that are from either the last 14 days or the last 28 days. 28 days just being a very conservative estimate. That way we know that the likelihood of infectiousness of this case is extremely low after 28 days. Even if the person is still in a recovery period where they haven't fully recovered from the virus, they are likely not infectious after 28 days. And if they are, they're in the hospital, and they're likely not going to be, it's more difficult to transmit, obviously, because the hospitals are much more careful than even what they used to be. So that being said, the number of active cases I have right now is estimated at either 18.6 thousand, so 18,622 cases at the low end, and at the high end, 28,700 cases. So Arizona has about 20 to 30,000 cases that are confirmed, that are basically could possibly be infectious right now. And that is, of course, out of our 244,000 cases that we've had since the very beginning.
So, and when we're looking at counties here too, it's something that we tracked as we saw that last surge sort of happen. We're the 4th most populous county here in Maricopa County in the United States. And for a frame of reference in this, at a time we had as many cases, putting us in the 3rd spot for case count. We're currently in the 5th spot for case count. So we're doing a little bit better, or other counties are doing a little bit worse, depending on how you look at that. And 7th for deaths here in Maricopa County. So just to update you on those numbers. The other number that people watch so closely, Garrett, is that R naught number. I know that it is less important when you're looking at it week to week. When we were on daily, we were talking about that number daily, but to just update folks and give everybody a look at an easy site, RT Live, that is very easy to read for folks. My gosh, though, that's not what you want to see. Only one state in the green.
Yeah, I mean, this is basically saying that they have confidence that as of right now, COVID-19 is essentially growing in every state in the union. And you can see we are sort of at this, we're at 1.12, sort of in the middle of the pack right here as far as growth. They do have a couple, they have one state, Mississippi, that's under 1. Oklahoma is just over 1, but after that, it goes all the way up to Rhode Island and Vermont, which is interesting because if you look at any sort of charts with Rhode Island and Vermont, they've always been at the low numbers of case numbers the entire time. So they seem to be experiencing an increase right here at this very moment. But we're at 1.12. We have been above 1.1 for about the entire week. If I go back probably several weeks now, we've been above 1 and above 1.1. So there is confidence that we are that things are growing here in Arizona. We'll look at this chart. It says that, and again, this is calculated every day. So whatever that says, that 1.12, it could have said that in September 12th, and it's going to be different. Right now, it says that our infections began growing on September 9th, and that it continued to about 1.12 throughout the entirety of October. It's been about 1.12.
Let's see. I want to get to more of the questions too. You guys have some really excellent questions coming in, and let me scroll back. Let me get to, oh, and by the way, there's a lot of good comments about what people are doing for Halloween. So it's, some people were saying they're making a super scary dinner for their kids, and then they're doing what I was talking about, leaving the bags at the end of the driveway for kids in the neighborhood. So people are getting creative about how they're taking part in all of this. You know what, Gary?
I'll bring up, oh, sorry, Katie.
Go ahead.
I wanted to bring up DVOC, 91-DVOC.com, to compare what's going on with some of the other states here, because I know that, we've got increases going everywhere, but if you look at this, and this is normalized by populations, new confirmed cases, you can see that Arizona, while we are increasing, we are certainly at the bottom of the pack here as far as the rest of the states. You've got states like North Dakota and South Dakota that their per capita numbers are higher than essentially it has ever been. This is New York at the very beginning, and this is us when we were at the top. Arizona was at the top back in July, early July. But you can see that's nothing compared to what's going on with North Dakota and South Dakota as far as their growth. We still are at the bottom of the pack here. If we look at some of these and we look at, say, the new deaths, you can see, again, Arizona is still at the bottom of the pack. So, as far as, things, obviously are not good as things are going up. But as far as when you compare us to what's going on in the rest of the country, things aren't extremely terrible in Arizona at this point.
Yeah, across the country and really around the world. We've been telling folks about France's lockdown, which starts today, and Belgium following suit, just now announcing their prime minister just announcing their nationwide coronavirus lockdown as well, happening in that country. We've been showing you some of the pictures of the hospitals that are overwhelmed there. Spain
Yeah,
is
Belgium's numbers are Belgium. I'm looking at that same site,
unreal.
91, and it's they're at 1 point. They're higher than anyone ever has been at 151.4 for the new confirmed cases. And when we were at our highest in the United States, it was 20.4. Nothing is coming even remotely close to where Belgium is right now.
Yeah, they are in crisis and trying to take action to get this thing under control. Italy's reporting more than 31,000 new cases. By far, it was their biggest one-day increase. So I say that all to say that when everybody brings up this is all about the election, this has zero to do with it. These are countries that don't have elections coming up anytime in the near future, and they are in crisis as well with these increasing numbers. So this is affecting everyone. This is not just a United States thing. We're seeing things in the Netherlands. They're reporting 11,000 new coronavirus cases. That's their highest daily total since May. So I'm seeing a lot of comments about the election, but I can tell you what everybody says, this is going to be gone after the election, Garrett. And I wish that were true, because Garrett and I are tired and we're going to be busy working through the election. But you know what? We're going to be here with all of you next Friday as well, updating you on this. So it really has little to do with that at all. Okay, so Garrett, talk to us about our hospitalizations. That then becomes the next concern. I talked with Dr. Frank Lavecchio on, I believe it was on Monday. He was saying he's already seeing people show up in the hospital there. He's seeing an increase in COVID case numbers. How are you seeing that reflected in your charts and your data that's coming in?
So we are seeing increases in hospitalizations. They aren't at this point matching the clip of the case increases, but we are seeing increases. And we have heard stories from other doctors, as you said, that I think we're actually interviewing a doctor today that says that he's been recalled for surge shifts at his emergency room, and he hasn't been on surge shifts since the early summer. So they are starting to prepare for what could occur. I do have some hospitalization data that I can share with you. Let me get over to where it is. Sorry.
And as you're pulling that up,
yes.
Garrett, as you're pulling that up, we're just hearing from the Maricopa County Attorney's Office. They are just announcing they will not be returning to in-person work any earlier than January 4th. So you can see how this is starting to show up reflected here. The governor just said yesterday, we are facing a storm. That he said that the storm is not here yet, but that we are indeed facing a storm. So I'm curious in the comments if you guys will let us know, during this sort of lull that we had, or a dip, if you will, were you kind of running around and getting those errands done, taking care of hospital visits and different things like that to sort of prepare for this increase, or you feel that the mitigation strategies you've been doing have been working, such as wearing a mask, and you'll just, pace things out as they go, dentist visits, doctor visits, all of those things. Curious to hear what you guys have found in that. All right, Garrett.
Sure. So here's basically the three biggest: ICU, emergency, and inpatient. ICU being the red line, the green line being inpatient, and emergency being the blue line. And you can see right here, around the middle of September, this is when our hospitalization data, let's ignore the blue line for now, but you can see the inpatient and ICU numbers. ICU hit a low just at the end of September. We started seeing an increase right here in the inpatient number, followed by the ICU. That is very typical of those numbers. The emergency room department numbers, this is a reporting error, but it should have been closer to this in this line. But you can see, even when you take into account where this hit a floor here in late September, it has been on the rise and is back to where it was, basically where it should have been in early September. So basically where we are is we're at numbers right now. We were at one point mid-September. That was at our low. Now we're looking at August. We're creeping up to August numbers. We were in a decline in August, but we're starting to basically match those numbers.
Okay. And Garrett, is this a chart that folks can find, or is this your internal chart?
This is an internal chart, so I don't have this anywhere. You can find all of these charts on the AZDHS website, though. They're just not together.
Yeah.
Let's put these together. This is like, say, ICU and ventilators. You can see how they sort of match each other right here. This is the inpatient occupancy. This is essentially the chart you see on the AZDHS website. And then there's some bed cap charts that I have as well, showing what's happened and how you've got a situation in which, when you look at the hospital assets, I think this might be inpatient. I'm going to ignore inpatient because I don't know if it's correct quite yet, but let's stay with ICU. ICU, 12% of the beds that are being used in ICU right now are from COVID-19 patients. Not a whole lot, but it is increasing. And I think that's what concerns people in the hospitals, the hospital administrations, that this number is increasing. And that, that brings our bed cap into the 90s again. And we're not there yet. We're at about 85, 86. The hospitals like to keep it in the 80s. So they actually prefer it to be in that level. But I think they're starting to get nervous because it's past 85% now. They don't really want it to get into the 90s.
Yeah, we have a lot of doctors and nurses who join us in the chat here, and man, I can't imagine facing this thing. And as Dr. Lavecchio brought up to me earlier this week, facing flu season as well. So they're dealing with twin situations right now as people head into the hospital. And you know what? I was seeing a lot of comments about the flu, and I thought we were past comparing COVID to the flu, but it's sort of seen a resurgence in conversation and comments out there, and I've seen a few in the comments here today. So I do want to address that. The flu numbers do come out from the state. We have always reported on flu numbers as it pertains to pediatrics. So it's just probably not the story people necessarily pay attention to in the middle of a newscast, but it is something that we always report. In fact, in 2018, we had a high number of pediatric flu deaths here in Arizona, and we were up to 5. And it was heartbreaking to report on those 5 families having to say goodbye to a baby. And that was an exceptional year for that group. So I want to teach you where to find the flu numbers. You can find those also on the AZDHS site. We want you to be empowered to find this information so that you understand it. We are only, Garrett, at 31 flu cases reported in so far this season, if you will. I want to remind folks, the season for the flu, as it's counted here in Arizona, starts on 9/27. So for a frame of reference, now that a lot of us are wearing masks, we are not seeing the numbers of flu as high. Normally it's about in the 180s. A lot of people will say, though, as you've heard, Garrett, and maybe you've had the flu and not necessarily reported it into the county or the state. So comparing those numbers is not such a talking point for folks. So they look to the deaths. There are 2 different ways that the deaths are tracked, both from the flu, influenza, and from pneumonia. So sometimes you'll see the numbers written P and I. That tracks those numbers. So when you're comparing any of these numbers in this pandemic, and we've lost almost 6,000 Arizonans to coronavirus, a typical year for deaths in Arizona to the flu is about 200. So 200 to 6,000, and that's counting a whole year of the flu versus the 8 months that we've been tracking coronavirus numbers. So
yeah, I've got the flu dashboard up, and I'm looking at it's right here in this one. What do pneumonia and influenza deaths look like in Arizona? Here's the 2 different seasons side by side. Here you can see the first week of tracking. There were 78 deaths from influenza and pneumonia. The year prior there were 51. So slight increases there, 63 to 50, and then it starts to 36, and now it's gone sort of. But again, these deaths, they get back populated, just like.
And Garrett, that is for influenza and pneumonia. I want to point out to folks right there at the top. You can click all, and then you can click both, and then so you can figure out how those charts look. And if you only click on influenza and you're tracking that, you do have to total up the numbers. It takes them about a year or so to put their final report together, and then you'll be able to see, like, for instance, in 2017, 2018, that full report is out. It was a busy season, and there were about 35,000 cases. Now, most years in Arizona, we see 12,000 to 23,000 cases. So that is where you can find that information when that flu conversation starts and you're looking to compare those numbers. So normally about 200 deaths here in Arizona, and when you put that together with pneumonia, it's between 600 and 800. So when you're seeing 6,000 COVID-related deaths and 600 flu-related deaths year to year, that is where you can find that, right where Garrett just showed you on the Arizona Department of Health site. So hopefully that helps everybody get the information they need. All right, let's talk age groups, Garrett. Age groups were so concerning when we saw people going back to school. I want to remind folks that it's split for 20 and under. We don't have the data split out for us specifically for double checking different age groups. So the only way we can really find that, Garrett, I think, is through going through Sonora Quest, and that's not an absolute, because that's looking at just who Sonora Quest has tested, which is a lot, which is a huge percentage of the tests. So you can get an idea, but it has its limitations. So what are you seeing in the data that's coming from the state on the age groups?
We do have, we see that about 34,582 people less than 20 years old have contracted COVID-19. That's about 14% of the caseload. That's been about 14% for a couple months, for about a month now or so, a month or two. But we do see, you know, when I'm tracking this every day, you know, it is more often than not that this under 20 does lead as far as the number of cases, the growth in the demographic, if you will. When you compare it to itself, we do see that that age group tends to lead the other age groups as far as the increases, and that's been the case for about the last month. So basically, as we're going into this new sort of this new increase, a lot of it is being led by either this less than 20 or this 20 to 44-year-old. Again, the 20 to 44-year-old was leading it the first time around, but
Right.
now we're seeing a lot more of the less than 20.
Yeah. Okay. And Garrett, when we're looking at this chart, I just want to remind everybody, you can find a lot more demographics than just age on this chart as well. You can find gender, ethnicity, different things like that if you're looking to understand how this affects our population differently here in Arizona.
Yes.
Okay, let's get to some of the forecasting on this. I know everybody's looking to the holidays and trying to navigate what feels safest for them. We've heard that the concerns about spreading are in the small family gatherings, and I know a lot of people are having tough family conversations about what to do, how to get together, should they go test before they get together, or how does that feel best to be safe, whether that's being on Zoom for Thanksgiving or Christmas. How that is for everybody is different, and we want to help provide the information so that you can get more info on it. And I want to let folks know, if getting a test is part of your holiday plans, or to get a test before, you can go to the site doineedacovid19test.com. Once again, doineedacovid19test.com. It'll show you, and also the Department of Health's website, where you can just go get that test pretty easily. In fact, Garrett, we were talking about the saliva test before. Before, it was at Tempe, and they had a testing site at the stadium, of course, the Cardinal Stadium. And then they also had a testing site down in Tucson. Man, you check that out now. It's got a pull-down menu for cities all over Arizona. So when we talk about this, I know we talk about Maricopa County a lot being the most populous county, but there's a lot of other testing sites. So if you checked it before, it didn't work for you, check it again, because it's got more info on it right now. All right, go ahead, Garrett. Sorry.
So, projections. Let's go with the University of Washington's projections. I do believe that they're much better than they used to be. I've taken out all of the other stuff, so it's just the projection, not talking about mask mandates or social distancing or anything that's a little bit more variable. And so what we can see right here, if we look at the total deaths in Arizona, you can see that they do believe that there will be an increase to February 21st of about 9,150 is where they think we're going to be in February, with a range of about 7,000 to 12,000. As far as the dailies, it is basically picking up the increases, and it believes our increases will continue through to basically December, early December, and then it believes that we're going to start leveling off again after early December. And then that's the same with infections. It's seeing our case rise right now and believes that it's going to stop in early November. So this is going to be interesting to see if this follows this pathway, to see if we do actually stop around this time, because that's only what, a couple weeks from now we would start to see a leveling off, which is absolutely possible. So, you know, we'll be watching this to see if this is correct. Now, this is an estimated infections. When we look at the confirmed infections graph, they don't have a projection for that. It's just showing what the numbers are like. But it's interesting to think that we might be, as far as this particular model, believe that we are going to be at the peak here of this new round here in the next couple weeks. Hospital resource use, none of the hospital resource use graphs show that we're going to be over the beds available numbers. There is in a worst case scenario on this one right here, this all beds. It does presume that there might be a worst case scenario in early December that we would be touching the all beds available. But at this point, it's not in any area does it go above that number. And you can see it's the same thing with all of them. This one actually, if you look at the ICU beds available, it does believe that there is a chance that we're going to go above the ICU beds available. And we'll see if that actually happens. And then the mask use graph, this is sort of one of the variables that they try to use. It does believe that Arizona is at about 66% and continuing as far as the number of masks that are used. I don't know how that's been calculated, so I'm not going to comment on that particular graph.
And Garrett, this, I know the updated, I can barely see the date there on the screen. It was just updated yesterday, I believe.
October 29th, yeah. Yeah, so I think every other day now at this point.
Yeah, usually you can get that update on there. And the nice thing about that is we're showing that to Arizonans, but you can check that for any state. Now they've added different countries in there, so you got a lot more information if you do have to travel. All right, it is Friday. To think about it for a minute, it feels like just work around the clock right now. It is Friday, and on Thursdays in Arizona, we're lucky enough that the county, Maricopa County, updates some of our zip code numbers. So we're happy to show you how to find this. We won't be able to get to everybody's zip code who are joining us on here today. Wow, I'm seeing a couple in the red right there already. We'll talk about it as we drill down through city, through zip code, through elementary school, and through high school. The reason I bring those up is if you're going to go check your own your neighborhood, you want to check all four so you can really get a really good idea of how things look. For instance, I always use my own example, but my zip code goes one direction and it was in good shape for a long time. And then my school district went the other direction. It was not in great shape. Interestingly enough, so I should check both of those when I'm looking. Interestingly enough, though, Garrett, they flip-flopped. So now I'm in the opposite case. My zip code's in a little bit of trouble and my my school district's looking better. So let's dive right into how this looks.
All right, we'll start just with the city levels. You can see that Paradise Valley, wealthiest area of Arizona, has a case per 100 of a 100 and is now considered substantial because of that. Remember, Maricopa does not use the all three metric system when they change to red. They use just one. And you can see another small Litchfield Park, and that one is from the week prior. And now let's move right to, we'll just go right through these quickly. This is the unified school districts. You can see the unified school districts, there is no situation in which one of them qualifies for red right now. Although when you look at Queen Creek, their most recent numbers right now, they are pretty high, 150 at Queen Creek with a percent positivity of 10% in that particular district. You can see 108 in Higley. In Gilbert, you can see 100 in Chandler. And by the way, they have to be it for at least 2 weeks. That's why they haven't changed to red yet. You can see Chandler. They're actually below in both cases. Mesa, the largest one, just under 100, so it's 95 in Mesa. We'll go to Scottsdale really quick, 91. We'll go to Paradise Valley's school district, and it's at 62. And then let's do some western side. Natterburg, 40, very good number there. Peoria, 86, and then Deer Valley, 69. Let's move to high school districts. All the high school districts are still considered moderate. Tempe, 74. Phoenix Union, 87, and that is an increase from week to week. We do have Tullis in here. It is in the red this week. It may flip next week. They are recommending virtual because of that. 110 cases per 100 with a percent positivity rate of over 10%. And then Agua Fria, 110. And then Buckeye is only 73. So, and then the elementary schools, we did have a few elementary schools flip. Here's one. Wilson Elementary School did flip into red. It's 150 case per 100 with a 10% positivity rate. That's going off of a 200 almost case per 100 the week prior. And then you can see Murphy here had a very high percent positivity rate with a low case per 100. That's the same thing with Riverside. lower case per 100, but a high positivity rate. And then here at Palo Verde, they had, you can see they have cases per 100, 0, but the week prior it was 218. So that suggests targeted testing there. Let's see, someone wanted Washington School District.
That's a good example, Garrett, of why when you just take a glance at the map, it's so important to click on your specific area, whether it's where you work or live, to learn a little bit more about the situation.
Sorry about that. Hold on a second. Yes, it is very important to look at that stuff.
I mean, you can see just a lot more, because when you first click on it, it's like, oh, everybody's yellow, great. But when you click down through it, you find a little bit more information about it, and that's why. You know, I always say to everybody, check all 4 places: your zip code, your city, your elementary school, your high school, or your unified.
Yes. So let's go to zip code. Sorry, Margaret. I don't know where it is. 85029. Let's see. Hold on. Let's see if that brings me there. Okay. Thank you so much. Washington School District. That is a 68 with a under 7%. So right now it's still technically within the bounds set for hybrid. So let's go right over to zip codes. I know a lot of people want to talk about zip codes. So we do have a couple reds today. We do have Paradise Valley is now considered a red zip code, 85253, with 116 case per 100. We have a couple others that turned red. Peoria, 117 there with a higher than 7%. We do have another one in Mesa. This is a new entry to the red here, 85204 with 113 and a 10%. And we do have this one right here is frequently in this category, 306. That's more than almost triple from the week prior.
009?
85004 has more than, yeah, 85004 has more than triple.
Wow.
85009, this is a very strange zip code. It tends to, I know it's very high right now. I've seen the numbers. They added 270 cases just this week, but they're not reflected in these numbers. So we should see them update next week. This one should be back at over 100, but it's not there this week. So here's another one. This is red from the week prior, 85019. Just going through some of the other red ones until we continue. 85305, 118. And then this last one, 85033, 130 with a 15% positivity rate. So these are some not good numbers to see positivity rates. You know, we don't want to see those numbers anywhere. 85120, that's in Apache Junction. I do not have that. I'm so sorry. 85295, if I can actually, use my keyboard. 85295 right here. You can see this one, 89.6 to and that's 5.8 positivity, and that's a slight increase from what it was the week prior. 85297, we're going to stay in the East Valley, it appears. 82.9, that is approximately double, a little less than double what it was the week prior. Let's see, 85308. 85308 in Glendale, that's about 20 higher, so from 60 to 82 with an under 7%. So that technically is still within the hybrid model right there. 85202. This one is Mesa, and it's at 71. It's about level where it was the week prior. And then 85349. That I don't have, sorry. 85379, I bet that's another one. There we go, surprise. 65, that is lower actually. You're not going to see a lot of zip codes that are showing lower numbers, so that's a good thing. That's from 74 to 65 in that zip code. 85349. Did we already do that one? Yes, we don't have that one. That is, I can tell you that's a pretty high zip code though. I do have that elsewhere. And that one is also both Yuma zip codes are very high for those who are looking for those. All right, 85351 Sun City. Very low numbers in Sun City. This is always good because this is a very high risk area for COVID-19. 30, 27 this week with a 3% positivity rate. So we want to see those numbers in Sun City.
And Garrett, we'll just do a few more and then wrap things up because we have a few more things to catch up on, and then send everybody on their way for the week. Yes,
Chandler Sun Lakes. This one did go from 49 to 81. That's it's still within the moderate spread, but it has shown increases. I'll do 2 more. 44, 85044 now a Tukey. This went from 48 to 72 with a higher positivity rate. 85. Who else? 006. Oh, David, I care. 85006 is went from 60 to 67. That suggests that not much changed in that zip code. This makes me think that something going on here is either with some sort of either the Maricopa County jail system or ASU. One of the two things is causing this to be in the 306 range, because that's insanely high for it to be community spread and the zip code surrounding it being that low.
So I want to get to a question that's just coming in. Sure. That is likely concerning to a lot of people when they see this. They see that pesky 3% on there. And Nick Marie's asking this, why are COVID-like illnesses consistently at 3% on the Maricopa dashboard? So this is a number that affects the whole area when it comes out. And Garrett, it comes out on Sundays. That's the day it's updated?
Yes. So that's a good question. The fact that it still says 3%, it said 3% for a long time, but you know what? If you look at the CDC's emergency CLI numbers, they have remained around 3%. So I think that even though it is consistent, at least with the way the algorithm works, that seems to be what it is. Now, you can make arguments for or against the CLI being used as a metric. I totally understand why you wouldn't want to see a metric that moves like that. However, it's not really moving that much. And we actually see that reflected somewhat in the hospitalization data, because we are seeing increases in hospitalization, but not at really, really aggressive rates. So I totally kind of makes sense that it would be around that 3% at this point and not really move from day to day at this point.
Which is why so many parents and grandparents are questioning that being one of the metrics for schools when they saw the plans for the schools, and it said if we go back in one of those three categories, you go to virtual learning. And now the game's been switched up, and they're saying all three need to hit that in the red to be able to really say that it needs to be shut down or gone back to virtual learning across the board. So that's why so many people are talking about that. We remember, Garrett, as that number ticked up from 2% not that long ago, within the last month, up to 3%. So
there is a place you can track this. I just want to give this to people before we go. There is a place on the CDC where you can track this on a daily basis. It's got about a 3-day lag, so you can't check to days. But if you want to see what's going on with the CDC or the CLI number, the algorithm for Arizona, you can go to this page. This is the CDC COVID data tracker, United States Trends in Emergency Department Visits. Just click on Arizona, and it's this purple line right here. And you can see, this is what I'm talking about. If we look at this was at 1.8 in September, and now it's at 3.2. So it sort of reflects that 3% in these numbers. And you can see there has been an increase in the CLI since September, but it's only been a couple points. So, this is a very slow moving metric.
So in these last few minutes, and thank you for showing us where to find that, Garrett. Sundays again is the day that it's updated. Okay, so as we've been telling you throughout this hour, there is more updated news that's just coming in. We are watching, unfortunately, civil unrest that is happening now in Barcelona, which is crushing to me. I love Barcelona. Anti-lockdown protesters have taken to the streets there. Some of the video, I just retweeted some of the video over on Twitter. You can find that on my Twitter account if you'd like. It's why so many people here, Garrett, are making arrangements to keep the public safe if there is civil unrest, either from the election or from continued COVID strategies to try to mitigate this thing. My Twitter account you can find at twitter.com/ or at Katie Rammel. That's just easier to say, at Katie Rammel. And you can find Garrett. He gives fantastic updates every morning on COVID, despite us asking so much of him to continue to cover the election numbers for us as well. You can find his Twitter account at Garrett_Archer. If Facebook is your preferred method, by joining us here, you can find me on Facebook at facebook.com/news from Katie. There are some, let me put it this way, very lively conversations going on over there about COVID that I'm having to kind of be the referee for in some cases. Any abusive comments will be banned. I always remind people of that. And thank you to all of you. I'm seeing some really nice comments coming in for us. We're We're sorry that we can only be with you once a week. We hope that you're, oh, thank you, Deborah. We hope that you're getting enough information and that we're teaching you the ways to find this for yourselves so that you can keep your family safe based on your health and your lifestyle. Oh, thanks, Diane. You're so welcome. And again, thanks to all of you writing the nice comments in here. For those of you watching on your favorite streaming device, we are so happy that you're joining us on there on Roku and Apple TV. We are going to be back with you, despite all the naysayers that this is going to be gone after the election. It'll still be here on Wednesday, Garrett. I think we can say that for sure. And Garrett and I will be back with you on that Friday to update you on this. We hope that we have better news and that all of you are staying safe. In the meantime, our coronavirus reporting can always be found at abc15.com/coronavirus, whole section there. And then if you need more schools information, we're constantly updating that. I do want to say a lot of you are finding the COVID school information on your child or grandchild's school based on their site that they have added. That is the best place to go. But we also have a schools dashboard, if you will, set up there. abc15.com/schools, our very latest reporting on that. Oh, I love all these sweet comments. You guys are so welcome. That's why we do this, just to keep you updated and keep you and your family safe and help you make the best choices for your life. So Garrett, with that, I'm going to actually see you in person in real life on Tuesday. We'll both be on election duty, as will our entire staff. Obviously, that is one of the biggest stories of our lifetime as well. So we'll be covering that, and then we'll be back with everybody on Friday. Oh, Eric writes, thank you for your professionalism. Thank you, Eric, for your comment. Kristen writes, good luck. See you next week. Garrett, a lot of people were asking if you are taking time off after the election.
I'll figure something out. Yes, yes, the answer is yes.
Okay. Well, they're approving it for you. You don't even have to ask our boss. It sounds like they're just saying you've worked hard enough. You can take a day off or two. All right. Thanks to all of you. And we hope that we will see you back here safely next Friday. Bye-bye, everybody.